Hello, this is Dr. Harun Ilyas, and in this video I will be talking about this significant incident where LeBron James went down while holding his underside and inside of the right foot. So if you are into mechanics and anatomy of sports injuries, consider subscribing to this channel. You can see in this video, before LeBron James fell down, he stopped for a second, and you can see the exact moment here where his ankle joint was not in a very good shape, and after that when he tried to jump, he wasn't able to land on the same foot, and after falling down he was holding his medial and the underside of his right foot, and he was saying that he heard a pop. That is not a good sign to see in an athlete of such a high level. So depending upon the side which LeBron James is holding after having a fall, I am suspecting that this might be a Lisfranc injury. So Lisfranc is one of the ligaments present in our foot, and it attaches medial cuneiform, one of our tarsal bone, with the metatarsal. So this injury usually occurs when our forefoot is at an abduction with our hind foot, when the foot is plantarly flexed. And with plantar flexion, I mean that the foot is pointing in that direction. And as you can see in this video, that LeBron James' foot is abducted and it is plantarly flexed while jumping. After that, LeBron James went down saying that he heard a pop, and the pop is usually heard when there is some kind of tissue tearing in our body. One of the things we can suspect here is that LeBron James might have torn apart his Lisfranc ligament, but this is very unlikely to say, because LeBron James was able to play after this injury, and after that we saw him moving out of the court, and although he also had some limp, but it wasn't so significant to be regarded as a tearing in the Lisfranc ligament, although we can suspect he might have some partial tearing of the Lisfranc ligament. But as LeBron James has said that he had heard a pop, and if you heard a pop, you always suspect there is a tearing of some ligament or some tissue in the body. So one of the other things that we can suspect here is the tearing of plantar fascia that is present on the underside of our foot. And plantar fascia's injury also usually happen when our foot is plantarly flexed. So as LeBron James is holding the underside of his foot, it is one of the differential diagnoses that he could also have some micro tearing, but nothing could be said clearly until his foot's MRI has been done. We can suspect different kind of diagnosis, but the doctors can only reach to one conclusive diagnosis once the MRI would come out. The third thing that we can suspect here is the injury to the medial side ligaments of the ankle joint, and these ligaments are important holding the ankle joints together, as they are attached to our tibia, fibula, and the tarsal bones. And we might suspect that there might be some micro tearing of these ligaments, but as LeBron James walked off after the press conference, it is hard to suspect there might be some tearing of the medial side ligaments of the ankle joint. So this is it from this video. If you like this kind of content, consider subscribing to this channel.